Hi guys, I'm Dr. Brandon Boyce. I'm a board certified orthopedic surgeon, fellowship trained in sports medicine, but have a general orthopedic practice. I've been doing orthopedic case reviews and providing expert witness testimony in the field of orthopedics in my spare time for more than the last decade, and thought that I would just want to share some of my experiences with that and just some tips for other orthopedic surgeons or students or anyone in the orthopedic field that has to deal with this and has to kind of live in this environment of kind of this litigious society. Try to offer some points and some tips that might be helpful. Hopefully maybe help you from getting sued at some point in your career, and just make you think about some things that might be helpful for that. But today I really just wanted to talk about the issue of informed consent, and something that seems very basic, something that we all do day to day in our practice all the time. It's something that really we don't think a lot about, because it's something we handle with every patient we do surgery on. But that's something that potentially can be the entire basis for a lawsuit. If you have a patient that comes in and complains that they didn't fully understand the procedure that you were going to do on them and perform, regardless of whether that patient had a known complication that occurred or not. If they feel that they were not adequately informed on those risks of the potential procedure or complication that they had, then you can get sued. And that's why it's vitally important to make sure that you have documentation showing the discussion that you did have with the patient, including the risks, the benefits, the alternative options of that procedure. Now, one thing that's important is knowing what informed consent is. That varies state to state. Not every state requires that you have a written informed consent. Some states say that verbal informed consent is sufficient enough. So you need to know what's the requirements in your state, what constitutes informed consent. How does that have to be documented on an informed consent form and in the medical record? Most states do require that there's a written consent signed by the surgeon, the patient, as well as a witness. And some of you may have consent forms that are pre-formed by your institution that you work at, another society, the American Academy of Orthopedic Surgery, whatever. There are different options that you can use. But in my opinion, again, I'm not an attorney, but in my opinion, I think it's best that regardless of your state's minimal requirements, it's best to document in your clinical note or consultation note or whatever medical documentation you're using for your clinical decision making to proceed with surgery. You want to make sure that you have that documented in the written record, in addition to whatever informed consent document or form that you have signed. So what I'd recommend including in that is that you document specifically that you had a conversation with the patient and potentially any family members present about the specific and known risks of that particular surgery or procedure. Even if you already have that written out in the informed consent form that the patient actually signs, put that in the medical record, document that you had that conversation. We also want to make sure that we document that certain risks are more common, certain ones are more rare. You don't have to break that down into percentages, but certainly inform the patient that there are certain more common risks associated or seen with that particular procedure, so that they're aware of that, but also that you can document that you had that conversation specifically with the patient. You want to make sure that you mention that you had a specific discussion about these risks, the benefits, and the alternative options. And I recommend using that phrase specifically, that we discussed the risks, the benefits, and the alternative options, and that was given to the patient and the family member. And then they were given an opportunity to assess that and to ask any questions that they might have, and that you took the time then to answer those questions. Then you want to make sure that you have documented that you gave the patient the chance to have those questions answered, and that the patient and or the family members present demonstrated an understanding of the patient's condition or problem, and therefore you feel this institutes informed consent. So those are things you want to make sure is specifically documented in the record. You gave them a chance to understand the risks or benefits and complications associated with a particular procedure. You discussed and gave them an opportunity to have their questions answered. You feel that their questions were answered appropriately and that they demonstrated an understanding of the procedure, and therefore that constitutes an informed consent. Now, obviously, as orthopedic surgeon, we occasionally run into emergency situations where we have an obtunded patient, or we have a patient that's unable to offer informed consent. You have a life-saving procedure planned. You have something urgent to the point where you can't reach out to a family member and get that. And in those cases, obviously, that changes things a little bit. You still want to make sure you document, in your H&P or your clinic note that the reason for moving forward without obtaining informed consent, and just have some sort of documentation as far as why that's an emergency, and in most cases that's going to suffice. So I've been doing these orthopedic case reviews for more than the last decade, and really, in my experience as an expert witness, attorneys are really not going to focus on challenging a system-wide policy or a state law that may come up in a bigger type lawsuit. But in this case, they're looking at an individual patient, and so in order to protect yourself, you really want to make sure that it never really hurts to go above and beyond what's required by your facility or by your state requirements. You really want to just make sure you're protecting your butt, and making sure you have it well documented. I know as surgeons, we're all busy. Getting an informed consent is common. It seems a bit of a mundane task, but it's something that we all have to remember as surgeons. It's important to the patient that they understand those risks, and it's important to you, really, as a surgeon in the long run, because you may be protecting yourself in your practice. So I encourage you to make sure you really document in your hospital records, your medical records, in addition to having an informed consent form that's complete, and make sure that you're having these conversations with the patients, even though it takes time. Again, I'm Dr. Brandon Boyce. Please like and share this video. If you have other topics you might be interested in me covering, please shoot them my way. I'd be happy to take a look.